इसको पूरा कर लो। जी, you can see me?
So yes, we can see you, but आपकी slides अभी तक वो नहीं हुई डिस्प्ले, presentation, screen share नहीं हुई आई थिंक।
अब हो गई है?
सर अभी नहीं हो रही, हो जाती है।
ये फुल है, सिर्फ हमारे लिए याद पूरे। मेरी आवाज आ रही है आपको?
सर आवाज भी क्लियर है, वीडियो भी है डिस्प्ले में, लेकिन आप ऐसे करें या तो दोबारा मतलब पहले प्रेजेंटेशन ऑन कर लिया करें, उसके बाद स्क्रीन शेयर करेंगे तो ऑटोमेटिकली इजी हो जाता है डबल क्लिक करने पे। आप दोबारा रीजॉइन कर लें मीटिंग।
दोबारा रीजॉइन करें?
सर ऐसे करके देख लें, मैं आपको कोर्स दोबारा बना दूंगा जी।
आमना, इनको ले जाए ना, हम आ रहे हैं।
ठीक है,
वी आर कमिंग टू यू बेटे।
सर अगर आप थोड़ा सा पीछे से अपना ये विंडो से हटा लेना, क्योंकि वो लाइट बहुत ज्यादा आपके, वो आपका फेस डार्क होता जा रहा है।
इसको बंद करते हैं, इसमें दोबारा रीजॉइन करेंगे। पहले स्लाइड को करते पहले फिर रीजॉइन।
देखने आपको निकाल देना इसमें से, कट नहीं हो रहा।
हेलो
जी सर।
हेलो
जी सर।
एक दफा आप इसको ऑफ करें ना उधर से,
चले मैं
फिर हम
आपको
रीजॉइन कर
लूं, रिमूव को।
हाँ कर दें।
जी सर स्क्रीन शेयर हो रही है।
जी हो रहा है इस वक्त?
जी सर हो गया स्क्रीन शेयर, स्टार्ट कर लें आप, टाइम हो गया।
जी थैंक यू वेरी मच, थैंक यू वेरी मच। बिस्मिल्लाहिर्रहमानिर्रहीम। इन द नेम ऑफ अल्लाह, मोस्ट मर्सीफुल, मोस्ट ग्रेसफुल। My dear colleagues, thank you for joining Take care of yourself, energize your immunity, and the ABC of living in these days is have a lot of good cleaning and hygiene habits, hand wash, face mask, have a very good diet round the clock, never omit your breakfast, have a very good sleep. Diet should be simple but balanced. Take lot of good exercise. Today we are likely to go through otosclerosis. Oto mean ear, sclerosis mean hardening of the bone. It's a relatively a common disease that leads to hearing loss. Patient usually feels fullness, heaviness in the ear, or straightly patient may say hard of hearing that's progressive. And in lot of individuals, many patients, the complaint is family history. Father, two brothers, few sisters, they do have the same symptoms. So it's familial disease as well. So what happens actually in the ear, as you know very well, dynamics of the ears are very simple and based on physics. We collect sounds from the ambience, from the environment, by a big ear, auricle. It's having different shape that collects the sound from environment. From this much big area, that's many centimeter, and it is transmitted into the ear canal. Those who will hear less, they will always put hand here, and the initial hearing aids were on the same principle. Big auricle-like structure placed here will help the hearing to some extent. That was the initial ancient hearing aids. So we collect the sound waves from the auricle, and from many centimeter area, these are converged, focused on 1 centimeter area in round figure, 1 centimeter, 10 millimeter, 11 millimeter vertical axis of eardrum. From here, the sound waves are transmitted at 4-5 millimeter area footplate of stapes. From this much area, the sound waves are converged here through the transmission inside the ear canal and middle ear. And ossicles are designed exactly according to the same principle. The outermost malleus is the largest ossicle, and the innermost ossicle is the smallest in the body. So it's converged from here. It will be discussed, it will be asked in exams. It's just lever and leverage ratio that acts perfectly how sound waves, sound impulses are converged from ambience environment into the inner ear. And from here, then sound waves produces impulses in the fluid of perilymph and later on endolymph. That is transmitted finally through the cochlear nerve into the brain. What happens in otosclerosis? The footplate of stapes doesn't work. This piston-like bone doesn't move. Slowly, it's slow down, slow down, slow down. Over a span of few years, first involves the 1 year, then it involves the second year. Otosclerosis. And the disease starts mostly from the anterior end. Fistula antifenestrum, anterior part of the footplate of stapes. Later on, it's just ankylosed. Pura joint jam ho jata hai. It is converted into, normally it is a piston-like, very fine movements. Very little whispering can move footplate of stapes very nicely. And what happens in otosclerosis, there is abnormal bone formation in the surrounding area of the footplate of stapes, and this joint, which normally moves with a small whisper, now doesn't move, even with the largest thundering sound. It is so much enclosed and hardened. That is a story of otosclerosis. And one word here, it should be clear for those who are entering now in fourth year, that otosclerosis is a hardening of bone in the otic capsule. The word auto is for ear. Sometimes we in quick, we don't listen each other. It's not AUTO, it's not auto. And we see on the papers written otosclerosis. Auto mean ear, auto mean automobiles. So please make a big difference. Otosclerosis, my dear colleagues, is an autosomal dominant trait. Inheritance, it's a dominant in transmission. It's a lamellar bone, normal Haversian system-like bone, Walkman canals, it converted into abnormal bone. The more abnormal bone is more cellular now, more vascular, and much more thickened. And the whole otic capsule, even inside the endolymph, it is converted into bony chambers. This is followed by, after initial more cellularity, more vascularity, more thickness, it is converted into a hard, dense, ivory-like bone. That is called otosclerosis. And the whole process of very fine movement, with the fine movements, with the little whispering, and the beautiful sounds of the ambience of the birds. Now hardly you can listen the shouts. That makes a big difference now. Pathogenesis is well known now, genetic mutation that leads to abnormality in collagen metabolism that is expressed mainly on the otic capsule. It could be autoimmunity against type 2 collagen fibers. There are more than 7-8 different types of collagen fibers, as you know. Persistent measles can end up with such disease. So this is just many hypotheses. Otosclerosis is very common in Caucasians, 0.5 to 2%. In the normal population, 50% of otosclerotic patients have a positive family history. So a significant number of patients who are having hard of hearing because of otosclerosis can have a family history. And as the disease progresses, its first patient complains from the 1 year, the battery is missed at that time. Later on, both ears are involved at the end of the day. So there are 3 different variants at anatomical levels. Fenestra, that's confined around the otic capsule. These are 85% patients. Involvement of stapes foot plates that causes ankylosis, absolute immobility. The joint is not dynamic, it is static, it is not moving at all. The joint is fixed now with progressive more and more otosclerosis. And as the disease progresses, both ears are involved. And the disease uncommonly in less than 5 to 10% patients can be involving the inner part of the cochlea. 2.5 tons of cochlea is converted into a bony otosclerosis. It may or may not be associated with fenestral, but most often it is associated with otosclerosis involvement also. So there will be sensory neural hearing loss rather than conductive hearing loss alone. Non-clinical or histological otosclerosis, such diseases are present elsewhere in the body as well, having more cellularity, more abnormality, normal lamellar pattern is disturbed. So more common than clinical otosclerosis. So it is very, very common. Stages of otosclerosis. Initially, sometimes the disease is very progressive, very extensive, very rampant. It's so extensive that if you look into the middle ear, see at the eardrum, it looks like red spot posteriorly, Schwartz sign. That shows activeness of the disease. And sometimes the disease is very slowly progressive. Then Schwartz sign are this purple color, red color in the oval window area, that is posterior part of the tympanic membrane, is not visible. So the main disease is focused on the foot plate of stapes. Sometimes it could involve stapes, also the cochlea as well. Then there's a combination of conductive deafness and sensorineural deafness. If there is very active disease here, we can see through semi-transparent. Eardrum is semi-transparent. Many of the pathologies present inside the middle ear can be appreciated through eardrum. If it is seen posteriorly here, red spot, then it is taken as Schwartz sign. Clinically, the most common symptom patient will say deafness, hard of hearing. There's a hearing loss, that's a progressive. First patient will complain in one ear, later on the second ear is also involved. And patient is always very happy when he's in the rush, in the people where a lot of people are speaking loudly, shouting in the open market, anarchally-like place. Certainly, people are speaking so with a high tone, you can hear very well. When there's very little sound, one-to-one, all alone, patient hardly able to hear. Tinnitus may be present initially. It's a pulse style in character, hissing in sound. Vertigo may or may not be present. If it is present, other problems like ototoxic drugs effects, acoustic trauma, exposure to very noisy sounds like more than 90, 95 decibels higher can lead to hearing loss and vertigo and tinnitus. So we should think again, patient can come to us with a hearing loss. If patient is young, like 30, 35 years age, 25 years old age, or the history is 10 years old, in the middle age, is a classical presentation of otosclerosis. How to investigate a case with hearing loss? Always will start with the precise clinical history. In otosclerosis, there is no history of trauma, no history of medicine, ototoxic drugs, there is no history of ear infections, and the ear examination is unremarkable. Everything is very normal. Eardrum is perfectly normal. Sometimes in 15 to 20% patients, Schwartz sign, the red spot posteriorly through eardrum is remarkably visible. That's one sign we can appreciate in cases of otosclerosis. Examination under microscope is a classical finding in every patient. Examination under microscope for ear pathologies is immensely mandatory. It is prerequisite. Auditory tests, pure tone audiometry will show certainly conductive deafness. Vestibular tests are usually normal. CT scan, MRI of the brain, and the rest of the area is absolutely normal, except there's a thickened bone in and around the aortic capsule. In and around the aortic capsule, everything is normal. Neurological tests like sensorineural, everything is found to be normal, except pathologies in the aortic capsule. Examination of the ear shows Schwartz sign or flamingo flush. Flamingo sign is seen in only 10 to 20% of patients. It shows posteriorly. It is cone of light. Here we can see in the posterior compartment red sign. If it's along the floor only, then certainly it is something different pathology in the name of chemodectoma or glomus body tumors, if it's along the floor only, sunset sign. Photon audiometry shows conductive deafness, and at 2 kilohertz, patient is having maximum dip, maximum hearing loss, that is called Carhart sign. So Schwartz sign, flamingo flush, Carhart notch is present in otosclerosis. Carhart notch is maximum hearing loss at 2 kilohertz, 2000 hertz, double cycle per second is appreciated in most of the patients. Schwartz sign is present only in 10 to 20%. Carhart sign in maximum number of patients you will like to appreciate. Tympanometry in such patients would show a sluggish movement of otosclerosis or footplate of stapes. Differential diagnosis, my dear colleagues, we must appreciate all the conditions that can lead to conductive deafness. The most common cause is glue ear, secretory otitis media, serous otitis media, mucoid otitis media, glue ear, so many names for one entity. It's the most common lesion perhaps seen in all ages. Each of us who is listening nicely is having history of secretory otitis media, glue ears, serous otitis media, so many names for one entity. For one entity, there are so many names. Gum-like condition in the middle. Throughout life, many a times we has had experience transient secretory otitis media. Sometimes it healed spontaneously. Sometimes your parents or guardians were so nice to come to a doctor and take the help. Medical treatment solves this problem. 80 to 90%, 80 to 85%. Rarely patient may need laryngotomy and grommet. Middle ears fibrosis, tympanosclerosis is another condition which is usually the bad outcome of serous otitis media, secretory otitis media, or suppurative otitis media. Congenital footplate fixation, fibro-osseous disc in various fibro-osseous footplate fixations in various bony conditions, various syndromes, ossicular discontinuity, Milius abnormality, osteoarthritis. So you listen, collagen fiber disease, CSF leak, degenerative changes, persistent stapedial artery, Paget's disease, osteitis deformans, and osteogenesis imperfecta with different Ponderhouse or Klein's syndromes. We should know few words among these because it may be. If you see patient with sclera that's blue, that shows the patient can have hearing loss. If the patient is having cleft lip or cleft palate, there's a high index of middle ear infections, glue ear. So these all patients will have some degree of persistent, consistent hearing loss. Cleft palate, blue sclera are the disproportionate of the skull with the rest of the face. If you see such patients, then certainly we should end up with such diseases like Paget's disease, osteogenesis imperfecta, even parathyroid hormone imbalance leads to many conditions. So management of otosclerosis is very simple. The most simple one where patient is not fully agreed, patient doesn't want any sort of invasive procedure, hearing aids are now available. These can solve the problem in unilateral base or bilateral hearing aids. Hearing aids can be used in one ear or both ear. As you know, there are so many different types of hearing aids. The most simple one are exactly CIC, completely in the canal. So 5 different types of hearing aids. We'll talk about it. One simple one is where the main battery or the machine is inside the pocket and a wire is going from the pocket inside the ear. This is the most cheapest one, simple one, analog type. It is available everywhere. It is called pocket sized hearing aid. It is most simple one and the cheapest one. Secondly, behind the ear, you see a small machine exactly like a glasses on the top of the auricle. That is moderate type. It's also available in analog and digital type. It's a moderate type of in price, but it's good in usage. And 2 or 3, the basics one are exactly inside the canal. Those ITC in the canal are simple, easy to carry, little bit more costly, but more effective. Those which are totally invisible, exactly on the top of eardrum, that is called CIC, completely in the canal. CIC completely in the canal is like just uh, so many machines inside we use that is not visible. That's exactly on the top of the eardrum. You can remove it, you can place it, but it is the best one. Patient can run. There is no need to remove during the bath. CIC is the smallest. It's having the best usage. Those who run, who are performing good activities, it can be used in both ears. That's called CIC. So hearing aids are the best way of non-invasive maintenance of most of the hearing problems. But the ideal way is stapedectomy. Foot plate of stapes is removed and it is replaced by a prosthesis. A similar prosthesis, similar to stapes, it is stainless steel, it's a Teflon made, these are available. The long-term usage, it's a very effective procedure. 90 to 95% patients can get benefit from stapedectomy, and the new word is stapedotomy. This procedure can solve the problem in 90% individuals, but it is invasive procedure. Few of them can have complications as well. Rarely medical treatment help. Very uncommonly sodium fluoride. Sodium fluoride can help in just a small number of patients. You may say 10% patients who are having very active disease, extensive disease, rampant disease, sensorineural hearing loss, we can think about sodium fluoride. It's initially given in 15 milligram daily dosage for a few years, 1 to 2 years. Then we can continue in half of the medication, like 25 milligram daily for the rest of the life. But this is only used in a very little proportion, like 10-15%. We don't have much experience, but these two procedures, hearing aid and stapedectomies, are the most common used procedures for the treatment and management of otosclerosis. What is the stapedectomy procedure? Its requirements are when the hearing loss is more than 15 or 20 decibel in conductive deafness. Speech discrimination is at least 60%, which shows that at least the cochlea should be sensibly, appreciably excellent. If there is a problem in the cochlea, stapedectomy will not help. External ear canal is having no pathologies like otomycosis. External ear canal should be dry, clean, free of infections. Patients hearing always, if we have to do this procedure, it is done in the worst ear. Ear which is having more hearing loss will be offered the surgery. Same is the principle for eardrum grafting. If the patient is having tympanic membrane perforation and he's not hearing, it's a bilateral disease, we will always choose the worst ear, the poor hearing ear first. If that ear is fine, the patient confidence level is achieved within no time, and patient and the family is very happy. Moreover, the better ear having better hearing is not offered the invasive procedure at the start with, so that if it, God forbid, fails in 1 to 2% patients, then certainly the better ear is at least on the safe island in secure condition. Contraindications of stapes surgery may be asked again and again. If there's only one hearing ear, invasive procedure, surgical procedure should be avoided. It is same is true for the only eye, same is true for the only ear. If somebody is having one ear, don't try to offer something which is obnoxious. Invasive procedures, some medicine that can hurt the ear, ototoxic drugs. One should be very, very watchful. Otherwise, you may be caught red-handed. You may add the misery of the patient. So we should take extra care if patient is having only one ear, the other ear is congenitally deaf, other is not hearing loss, or there is other pathology in the ear, and patient is having only one ear to survive, one eye to survive, then all secured, safe procedures should only be offered. Most of the surgeries should be hold on, not to be done. If the patient is having Meniere's disease associated with otosclerosis, we are certainly, because the pressure is so high in the perilymph, endolymph, then certainly patient can have no benefit from such surgery. Even complication rate is very high. Patients who are having very high stress conditions, and internal pressures are raised, like boxers, like athletes, like constructions on high altitudes, on mountainous area hiking, air traveling very frequent, ear surgery, such fine ear surgery should mostly be avoided. A patient is employed in a very high tone, noisy places, certainly such surgeries may be avoided. Rampant active infections, acute infections are certainly a contraindication not to do stapedectomy. Pregnancy, certainly most of the surgeries, elective surgeries are contraindicated during the sacred 9 months of pregnancy. My dear colleagues, just allow me to close the door for 1 second. So, counseling of the patient should be very fine. Hearing aid can solve the problem, but cannot stop the disease process. A dead ear may occur in 1 to 4% of patients, those who are undergoing surgery. So patient has gone through surgery, but 1 to 4% of patient can have total deaf ear. That ear will not be used for hearing aids anymore. So certainly these worst conditions should be explained. There's 90% chance of benefit, but there is 4% chances of the dead ear as well. 10% patients have no benefits. Those 100% has gone surgery, 90% will be fine. 10% will certainly say hardly there is some benefit. Again, they have to use hearing aid. So there is limitation of the surgery. Patient can have tinnitus that may be worsened after the surgery. It has been seen in long studies. Facial nerve paralysis or paresis has been seen in all the middle ear surgeries, although the incidence is very low in safe hands. So two things, what we appreciate, it's a foot plate of stapes. Small hole is made mostly in the posterior part, because that's more physiological place for the piston movement. Piston movement is more here. So we just make 0.6 to 0.8, 0.6 to 0.8 millimeter hole inside the foot plate of stapes. First we thin out, then with a small needle we just make crackling, twirling movements, rotating movements, so that everything is fragmented, ice broken effect. Then these particles are removed with a hook. And now the foot plate is only remain the supraspinatus. हेलो
जी सर, आवाज आ गई दोबारा। सर आवाज भी
जी।
चली गई थी और स्टक हो गया था। दोबारा
आवाज
शेयर
स्टक हो गई थी।
जी जी सर,
ये
शेयर करनी पड़ेगी आपको स्क्रीन दोबारा।
ये पिछली वाली स्क्रीन पे चले जाएं।
जी बिल्कुल, आप प्रेजेंटेशन दोबारा शेयर करें।
प्रेजेंटेशन।
जी यस सर।
Now everything is visible here.
Yes sir, but presentation is not.
Presentation is not visible.
Yes sir.
Now it's visible.
No sir, still not visible.
Slides are not visible.
Yes sir.
इसको दोबारा से रिस्टार्ट करें।
जी सर, आप दोबारा शेयर करें स्क्रीन।
स्क्रीन शेयर स्क्रीन।
सर ये नीचे बार लाइन पे आ रहा होगा शेयर स्क्रीन, मोर के अंदर या तो आ रहा होगा या ऊपर बार लाइन में आ रहा होगा शेयर स्क्रीन। चेक कर लें।
अब ठीक है।
सर अभी प्रेजेंटेशन नहीं अभी तक डिस्प्ले हो रही, शेयर नहीं हो रही स्क्रीन।
स्क्रीन में मुझे अभी नजर आ रही है, तो अपनी स्क्रीन तो नजर आ रही है। स्क्रीन नहीं विजिबल अभी भी।
सर स्क्रीन शेयर की ऑप्शन में जाके आप अपनी प्रेजेंटेशन देखें, वहां पे होगी, उसको डबल क्लिक करें, वो
स्क्रीन शेयर इधर तो मेरे सामने जो है उसमें एवरीथिंग इज फाइन ऑन माय साइड।
सर हमें बिल्कुल ही व्यू में आ रही।
चले, you can hear me. There's one way. So there around I do have 20 minutes more. हेलो
जी सर, मैं देख के बताता हूँ आपको आपके कितना।
हाँ, अदरवाइज मैं वैसे रिपीट कर देता हूँ ना
जी,
बात।
जी,
अगर मैं इफ यू कैन सी मी।
सर 10:20 तक है आपका लेक्चर, 10:18 हो चुके हैं। आई थिंक 2 मिनट्स लेफ्ट।
2 minutes. So I will just repeat these words. You can see me?
Yes sir, we can see you.
So I will repeat just the main words. Otosclerosis is a disease of middle ear. It involves mainly foot plate of stapes. It's a familial disease. It is autosomal dominant trait. Patient will complain mainly hearing loss that's progressive with a positive family history. If we see such a patient's clinical examination is usually normal, there could be in small number of patients short sign or flamingo flesh, that's redness behind the eardrum. On pure tone audiometry, we can see Carhart notch at 2 kHz frequency. The diagnosis is very simple. On radiological investigations, everything is normal except the aortic capsule. It's of 3 different types. It can involve only foot plate of stapes. It can involve with the cochlear component. It could not be confined to this place in the middle ear. Such pathologies can be present elsewhere in the body in the name of otosclerosis, having symptoms according to the area of impingement. Treatment, my dear colleague, is very simple. We can offer non-invasive, that is hearing aid. Hearing aids are 5 different types. We'll talk about these. CIC and ITC in the canal, hardly visible, are the most favorable one. Stapedectomy is a treatment of choice. We remove the foot plate of stapes. It is replaced by a Teflon piston. That is the best. Stainless steel piston has been used in the past, Meggy, but now it's not being used. The Teflon, the Shia piston is now perhaps of choice. Stapedectomy with a Teflon piston is the best way of surgery. There is 1 to 4%.
Lecture time is over. 1 minute ऊपर हो चुका है. 10:21.
Sorry, just in 1 or 2 seconds.
Okay,
so have a very good time. If you have any feedback, I will be more than happy to answer as I have given you the number. Please just give me your feedback. That will certainly leads to more refinement. I'm so happy to see you. Take care of yourself. God bless you. Thank you very much. Thank you very much for listening.